I didn't have Medicaid, I wouldn't know what I would have done. Quality of life would have been kind of bad.
I started working at Crossing Healthcare about 3 years ago as a nurse practitioner. I'm thankful for the Medicaid system as our health center treats the whole person.
Without SIU, I would have probably hurt myself or even be stuck in bed every single day still.
I found myself homeless, jobless, hopeless, helpless. I went into a homeless shelter.
We really service our patient population through a trauma-informed lens. That's through medical health care.
If it wasn't for them and the funding that we received through Medicare and Medicaid, I don't know where I would be. Probably dead, probably lost, wandering like I was.
And if it wasn't because of that, I would have probably been in a hospital right now, having bad thoughts about myself.
For many folks that I've worked with, they have not had access to health insurance for very many years. They didn't know they had chronic conditions, and they didn't know where to go or how to gain access to healthcare services.
I became homeless. I stayed in and out of many mental institutions. So finally I got connected with the Center for Human Services and Chestnut Healthcare Systems, where the doctors helped me to work through some of my issues.
Because of Medicaid, I am able to get the medications that I need to live my daily life.
Finally being diagnosed properly, I was able to get on the proper medications.
I worked at a restaurant. I was on my feet pretty much all day. And I had an arthritic hip. And one day my SI joint went out, so I didn't know what I was going to do because I didn't have the finances to have the surgery.
If Crossing Healthcare or the Medicaid system wasn't available, our patients would not be able to receive care. That would increase healthcare costs because they would be using services in the emergency department.
I was able to have the surgery a year ago, and this March 30th will be a year. So it hasn't been a year yet, and I'm walking. And my quality of life, I hate to keep saying that, but my quality of life is so much better.
Now I have resources and other things to try to help me get by during the day.
Now that I'm healthier, I feel like I'm more capable of doing more difficult stuff.
I hope that, our senators, our representatives, our communities will keep these programs going because people like me are able to benefit and have a well-being of life as well.
I was diagnosed with PTSD, and in turn, now I help out women that have been battered from men or just bullied.
And together we work as a team to help me to function and be an asset to society rather than a detriment.
I was looking at 6 years of being in prison. If it wasn't for the help of them getting my life together and proving to everybody that I wanted help, I needed help, and I found the help through these programs, through Chestnut System.